more?
That's a great question. Not necessarily, not necessarily. I think that oftentimes the intensity of exercise and the volume of exercise get quantified together with epidemiologic studies. So it doesn't necessarily mean that individuals need to start going out and doing sprint hill workouts or anything like that. I think the key is to consistently perform the exercise throughout sort of a given week and throughout a given lifetime, and to try to stay consistent rather than doing exercise for a week and then maybe stopping for 6 months or something like that. So I think consistency is really key. Again, these epidemiologic studies attempt to give as much descriptions as possible with intensity and hours, but we just need to be careful to not think that we need to exercise at really extreme intensities in order to see the most benefit. That's not necessarily the case, but moderate to vigorous. So like I mentioned in the earlier slides, so sort of brisk walking and up are sort of the keys there. Light exercise has not yet been found to have a strong risk reduction impact.
And can you split the exercise time interval? So if you exercise for 15 minutes in the morning and 15 minutes in the afternoon, is that as effective as 30 minutes continuous?
Yes. Yep. That's an awesome question. Yes, there's actually been studies that have looked at breaking up exercise into these smaller bouts, and absolutely, there's more clinical physiologic data to show those benefits than there are epidemiologic data, but it is absolutely effective at accumulating those minutes and ultimately getting those great preventive benefits.
Great. And just one last question. Should patients or individuals be monitoring their heart rate level to define moderate versus vigorous?
That's a great idea, and it is definitely advisable. If you're comfortable with a device like a Fitbit or an Apple Watch, or you can take it yourself, then that's always a great way to monitor intensity. Usually moderate is going to, you definitely want to take a look at what your maximum heart rate level would be, and then get within a certain percentage of lower than that. So moderate is usually going to be about 50 to 65%, sometimes even up to 75, and then vigorous would be higher than your maximum. But if you're comfortable with that and it's a great way to track it, then I would say yes. Another way simply would be to ask yourself, how hard is this going right now? So there's something called the ratings of perceived exertion, RPE, and you could use sort of a 1 to 10 scale. 1 being this is so easy, I could do it all day long. 10 being I can't do it anymore. And you should stay within that sort of 5 to 7 medium range there. And often so that you can talk, but maybe not talk too much is sort of a good gauge as well.
Wonderful. So now we're going to move on. Thank you, Christina. We're going to move on and put